I want to present an on-site educational game on global health for health professions student, which name is Iran International Public Health Summer School or IPHS. The story of IPHS goes back to 2013. On that time, we began to wonder why the health professions student don't have interest in public health education or don't enter to this field for either learning or further activities. Actually, we thought that public health is a very attractive field. Then why there is no motivation for it? To answer this question, we decided to design and hold an educational course to face and assess the students' need directly. And as a result, we got a precious experience. We noticed that students are actually runaways of lectures of theoretical basics and in contrast, eager and ready to participate in practical activities to learn skills. Indeed, they wanted to play games. So, let's redesign the course. Comparing the skills defined by the Public Health Foundation as core competencies for public health practitioners with the educational goals defined by the Association of Schools and Programs of Public Health as essential for MPH graduates, we observed a difference, a gap, between the education the students get and the competency we expect from them. So, we thought that the solution was to fill this gap with a 52-hour on-site game which runs in 1 week, full-time and ongoing. To fill the environment of IPHS, I'd like you to show you a short clip.
Health is your mission. Excellence is your objective. And you should be successful. We will work together. Your team is your wealth. Watch out. You can't lose the evidence.
Some people have escaped quarantine.
This disease is beginning to get out of hand.
No matter if you win or lose, if you learn, you're the winner.
It was so friendly and warm, and I just can't believe that it's over right now. I think I'm gonna cry again. I'm actually crying.
We chose the main goals of the curriculum in a way that all major domains of public health be introduced to students on a basic level. We put the educational goals in different units during the distance learning course and provided more advanced and practical contents for each domain during the on-campus course. Classically, these educational domains are placed in the curriculum separately, but we wanted to have all of them together as it is in the real world. We wanted no gap between them, so we used a story to connect them. This is the story of IPHS. Participants are deployed as public health specialists of a region, and their mission is to design a program for improvement of social determinants of health in that region. In the first step, they need to convince the governor to support them during their activities. Then, they have to evaluate the current data of the region and determine the health priorities. But because of the incomplete available data, first they should design a surveillance system. Meanwhile, popular protests are begun in the community against a factory which is claimed to cause environmental pollution. Participants are asked to do their risk assessment, but on the opposite side, the governor defends the factory and threatens to fire the public health specialist. So they perform the health impact assessment and try to suggest a new location for the factory for the governor's satisfaction. But it does not work, and they were just being fired that a little outbreak occurs. Now they have to investigate and control the outbreak. With successful control of the outbreak, the governor allows them to continue their activities. With the priorities determined, they write a program to intervene in social determinants of health, and then they run it as a trial. Based on the outcome of the pilot program, they developed their policy brief and presented it to the headquarters to choose the best program. As you may see in the map, during various parts of this story, goals are repeated several times and interdisciplinary abilities are required in almost all steps. But we wanted more than this. We wanted a spicier story, more thrilling and more joyful, which resulted in a storyline follows a science fiction plot in 2200, which takes place after the annihilation of Earth in another galaxy. To make some episodes more alike of the real world, we designed a platform that let participants choose some interventions among the list of all available interventions. Each intervention, like in the real world, costs a specific amount of money, human resource, and time. So by choosing and implementing the intervention, the outcome is indicated to groups by graphs, tables, and other kinds of data. To maintain the trainees' motivation of learning until the last moment of the game, we implement some game mechanics like competition and achievement. We defined competition in both the individual and group level to make participants interested in the progress of their teammates in addition to their personal development. For the evaluation, we ran a pre-test and post-test which contained questions about participants' attitude and public health. A Wilcoxon signed rank test was done and the results show that all the attitudinal change was meaningful in all questions except one. According to the results, IPHS was able to make students sensitized to public health issues and also motivated and interested to participate in public health programs. Also, more than 80% of the students gave scores more than 8 to the question that games are a proper way to learn public health. An overwhelming percentage of the respondents, more than 90%, with scores more than 8, said that they've enjoyed participating in the on-campus course. Despite the considerable amount of time and energy in designing and holding IPHS, the participants' satisfaction and attachment to it motivated us to help IPHS for 5 years. But we have to think about how to design such courses in a way that costs less effort and human resource, more easy to handle and more scalable, because we believe they're worthy of. Our main partners in holding this course were Tehran and Isfahan University of Medical Sciences, and with no doubt there were other key partners who helped us to hold IPHS. IPHS is represented in the World Health Summit 2016 held in Berlin, and also it's the award winner of the field of learning methodologies in the National Medical Educational Festival in Iran. Thank you very much.